All right, you're going to want to hear this. A company called Unity First Therapeutics just sent something to the FDA that is, well, it's pretty audacious. We're not just talking about a new therapy here. We're talking about a proposal to fundamentally change how medicine is made by swapping out biological chance for what they claim is pure mathematical certainty. So, just to get a sense of the scale here, look at this. On one side, you've got end-stage heart failure. That's a 50% chance of dying within 5 years. That's worse than most cancers. And on the other side, a therapy that claims a purity score of exactly 1.00. Think about that. Not 0.99, not almost perfect, 1.00. Provably perfect. And we're not talking about some rare disease here. This number, 300,000, that's how many people die every single year in the US alone from end-stage heart failure. Right now, for these patients, there are no cures. It's just a grim waiting game, managing symptoms, maybe getting a complex device, or hoping against hope for a heart transplant. And this gets to the core problem that Unity First says they've solved. You see, even our most cutting-edge biotech today is really just a sophisticated game of chance. You grow some cells, you add some ingredients, and you cross your fingers. Having 20 to 30% of your batches just fail, that's considered normal, just the cost of doing business. It's all based on trial and error and statistics. But this is where Unity First walks in and says, we're done playing that game. They're proposing to throw out the entire rulebook of chance and replace it with an ironclad promise of absolute, verifiable certainty. So, what is this miracle therapy? It's called APCT. I know, it's a mouthful. It stands for Autologous Purified Cardiomyocyte Tissue Construct. But here's what it means in plain English. They take a tiny skin sample from a patient, and from that they grow a brand new, beating piece of heart muscle that is a perfect genetic match for that person. And if the science sounds incredible, just look at the economics. A heart transplant can run you $1.4 million. Their proposal says the total cost for APCCT will be around $66,000. They actually call this paradise economics. I mean, a 95% cost reduction that would save the healthcare system billions upon billions of dollars. Now, this didn't just appear out of nowhere. This number, 23, that's how many years they've spent developing the unique mathematical framework that this entire thing is built on. So yeah, this has been a long time in the making. And to really get how this is possible, we have to look at the math, because it's totally different from anything being used in biology today. This is the real heart of their claim. And honestly, this is where things get really fascinating. So get this. This is a direct quote from their official submission. 0 Greek concatenation confirmed. What on earth does that mean? It means they have systematically kicked out concepts from classical Greek math. Things like irrational numbers, approximations, even the number 0 in some cases. All gone. One of their core ideas is something they call quadrants. So instead of using distance, which can lead to messy, endless numbers like the square root of 2, they just use its square. It lets them work only with clean, exact, rational numbers. In their world, pi isn't 3.14159 and so on. It's just 3. Exactly. It's all about rejecting approximation. No more guessing. To help you get your head around it, their documents use this really powerful analogy. They say to think about controlling biology like you're playing a simple game, kind of like chess or Conway's Game of Life. You start with simple pieces on a board.
But the rules of their game, they aren't just made up. They're based on the Fibonacci sequence. You know, that pattern of 1, 1, 2, 3, 5, 8 that you see everywhere in nature. It's in flower petals, snail shells, the branching of trees. They believe these are the fundamental assembly instructions for life itself.
And the whole point of the game, to use these simple, natural, exact rules to steer the messy, chaotic process of cells growing and changing. The goal is to remove all the randomness, all the probability, and to control the final outcome with perfect mathematical precision. You're not hoping for a result, you're calculating it. Okay, so that's the theory. But how do you take this really abstract mathematical idea and actually use it to make a real-world medical treatment? This is where we bridge the gap from the pure math to the actual patient. This is it. Their concrete 7-stage manufacturing protocol, it's like a recipe. You take a tiny 2 millimeter skin sample, and over just 28 days, you guide it through these very specific stages. And every single step, from reprogramming the cells to putting them on a scaffold, isn't guided by best practices. It's dictated by their mathematical rules, using things like Fibonacci time steps. So, how do they know it's all going according to plan? They have this system called the I am solid validator. Now, this isn't your typical quality check where you test a sample at the very end. No, no. This thing is like a mathematical referee, watching every move 24/7 in real time. It's not testing a result. It is literally verifying the proof as it's being built. The entire process, the whole shebang, is governed by this one master equation. It's the ultimate rule of the game. The state of the cells must obey this law at every single moment. If, for any reason, it deviates, even for a microsecond, the whole process just stops, dead in its tracks. You know what that means? A bad batch is mathematically impossible. It either follows the exact path to that perfect 1.00 purity score, or it doesn't finish at all. And this claim of certainty, it's not just some philosophical idea they have. It is grounded in 4 formal theorems that have been proven mechanically by a computer using a proof assistant called Lean4. This is so critical, it completely removes human error or interpretation. The proof isn't just written in a lab notebook, it's verified in the code. Okay, so all of this, the math, the process, the proofs, it all builds to their final and frankly most revolutionary request. What they are asking the FDA to do is just as radical as the science itself. Right now, the way things work is built on statistical trust. A company makes, say, 30 good batches in a row and tells the FDA, see, you can trust us, it's reliable. Unity First is flipping the table over. They're saying, don't trust our batches, forget the batches, verify our math. We're giving you the code, the proofs. The result isn't just probable, it's inevitable. And they're not just making a bold claim and walking away. They are literally handing the FDA the keys to the entire kingdom. They're providing free open source tools to check the logic, a live data portal to watch the manufacturing in real time, and of course, those complete, irrefutable, computer-checked proofs. They are inviting the deepest level of scrutiny imaginable. And this is the mic drop quote from their submission. It says it all. This is not faith. This is mathematics, and mathematics is certain. They're arguing that they've successfully lifted their therapy out of the murky, uncertain world of biology and placed it into the clean, absolute world of math. And don't think this is some far-off sci-fi dream. This is their actual proposed timeline. The papers are in, they're expecting a meeting with the FDA in the next couple of months, and they're aiming to start clinical trials in 2026. This is happening now. So this leaves us at this incredible crossroads. Are we looking at the dawn of a new era for medicine, an era where creating living tissues is as precise and predictable as writing software? Or is this a stunningly beautiful, logically perfect fantasy that's about to shatter the moment it collides with the messy, unpredictable reality of biology? The answer to that question is going to change a whole lot more than just heart disease.